Hello, I'm Paul Room and I'm a GP who practices in Kent. This film is designed to help you support patients with a diagnosis of cardiomyopathy and who may have common questions and issues about living with the condition. After being diagnosed, our three patients have returned to their GP with some follow-up questions. Aaron has been diagnosed with dilated cardiomyopathy and has some questions about his lifestyle and living with the condition.
Hi Aaron, how can I help today?
Yeah, I've been to see the cardiologist and they've told me I've got dilated cardiomyopathy. I'm still feeling a bit tired, but I've been told that could be the drugs. I was just wondering if I could ask a couple of questions.
Yeah, sure, go ahead.
Many patients say that starting on drug therapy can be as bad as the initial symptoms. Standardised doses affect people differently. Side effects often settle down if the patient perseveres with the medication. Key points to remember here are, if such resources are available, patients with heart failure can be referred to a heart failure nurse specialist. There are also NICE guidelines on treatment of heart failure you can refer to.
I used to do a lot of running. Now diagnosed with this, I don't do none at the moment. I was just wondering if I would ever be able to go back to it at all.
It's quite a difficult area, unfortunately, and there isn't any official guidance on people and exercising who've got a diagnosis of dilated cardiomyopathy. At this stage, particularly as you're just sort of settling into the drugs, and particularly as we're going to be sort of stepping them up and increasing them and trying to get you stable, we would advise against the running and against any sort of competitive, strenuous exercise. Having said that, we would still want you to sort of be physically active, and it is still important to do some form of exercise.
Cardiomyopathy is an individual condition, so each patient is different, but there are some general points about living with the condition to take away. Exercise is a difficult issue to advise on due to the individual nature of the condition, but it's prudent to advise against strenuous and competitive exercise. You can find more guidance online. You could also consider referring the patient to a cardiac rehabilitation service.
I've also got a holiday booked with the lads. I was just wondering if it's still okay to go and if I'm allowed to drink while I'm over there.
Is it soon, and where are you off?
Fairly soon, yeah, we're going to Spain.
Right, okay. So, if it's quite soon, it's probably better not to go. Just again, as you've only recently been diagnosed and just trying to get things sort of stable and get the drug regime up and things. But yeah, certainly in the the long term, when things are a little bit more settled, going on holiday and things should be absolutely fine.
Okay, can we do anything, because I've paid for it already, is there anything I can do about that to get the money back if I can't go?
Yeah, sure. I mean, it's quite easy. You just need to get in touch with your insurance company, and they'll give you a form, and there's a bit for you to fill in, and then if you give it to me, I'd be very happy to sign it and say it was with medical advice that you shouldn't go. We can get that sorted.
Okay, thanks very much.
All right.
Cheers.
Holidays are a common question, as patients may experience a temporary change in lifestyle. Short haul could be a better option, and the destination is important. Does the country have a developed healthcare system in case of emergency? Patients should arrange additional health insurance with companies that provide cover for people with pre-existing medical conditions. They should take copies of any recent clinic letters and ECGs with them, and they should ensure they take adequate supplies of their drugs. Alcohol is an issue for people with cardiomyopathy. Alcohol is a cardiac suppressant, so if possible, patients should exclude alcohol, or if not, avoid drinking to excess. It is likely that Aaron will be advised not to go on this trip at the moment, but generally patients with cardiomyopathy can manage their condition in the longer term, go travelling and return to a good quality of life. Eddie has returned to his GP after being diagnosed with hypertrophic cardiomyopathy.
Morning. How can I help today?
As you know, I've been seeing the cardiologist, and I'm sort of a lot happier that I've now been diagnosed and I know what the condition is, and that's sort of a relief in a way to know what the situation is. there may be a possibility I might have to have a defibrillator fitted, but they're going to let me know about that. So we'll cross that bridge, I guess, when we come to it.
Yeah, sure.
But I'm a bit concerned about family. Having looked on the internet, I see that this condition can be passed through to family. And I have grandchildren now, and I was just worried if I should be, or if they should be screened at all.
It's hypertrophic cardiomyopathy, isn't it, that they've diagnosed you with?
So.
Yeah, and like you say, I mean, it is or can be inherited, and there is a 50% chance of your children having it.
Right.
I mean, very much what they do is what they call first-degree relative screening. So by first-degree relatives, they mean your brothers, sisters, and your children.
Oh, okay.
And they would look at sort of screening them first of all to see if they've got hypertrophic cardiomyopathy themselves.
All right, okay.
And then based on that, they then make a decision as to whether they then need to screen their children, so your grandchildren.
What should I do if they are showing any symptoms or similar symptoms to what I had?
If they've got symptoms or the parents got worried about them, then they should go along to speak to their own GP and discuss things with them.
Right.
And obviously it's important for them to say that you've just been diagnosed with hypertrophic cardiomyopathy, so that they can sort of bear that in mind, if needs be.
Often, when someone has a diagnosis of cardiomyopathy, they will be concerned about the impact on their family and want them screened. Initially, screening is carried out on first-degree relatives. There is no difference between race and gender with inheritance. People presenting later in life may have the late-onset variant of hypertrophic cardiomyopathy, so their children should be screened every 5 years. Patients are often concerned not only about the impact on their family, but about day-to-day activities like driving.
The only other question I have is about driving. Am I able to drive?
Yeah, it's quite a complicated area. At the moment, we need to make sure that your arrhythmia, the heart muscle, the heart disturbance is stable.
Okay.
So at the moment, I'd say you shouldn't drive until you're next seen by the cardiologist. Once things are stable, there are certain sort of guidelines and things that we'll look at, but you normally then can drive. It might mean reapplying for your licence and that sort of thing.
All right, okay. Well, thanks so much for that.
Patients with cardiomyopathy can drive, though this will depend on whether the symptoms they experience incapacitate them in any way. Consult the DVLA website for more information about cardiomyopathies and driving. Emma has been diagnosed with arrhythmogenic right ventricular cardiomyopathy, or ARVC. She has had an implantable cardioverter defibrillator, or ICD, fitted.
Hi, Doctor. So I was wondering if you could help me. I've seen a specialist now, and they've said that I have this ARVC.
Yeah, arrhythmogenic right ventricular cardiomyopathy. You've seen the letter. It's quite a mouthful.
Yeah. And I understand it's a lifelong condition, and I'm just, trying to learn to live with it. And I've also had this box fitted.
So you got the ICD, the internal defibrillator. How are you coping with that?
Well, there was a few things I was worrying about because I was reading a lot about it online, and quite a few articles said that the box can give out shocks wrongly.
Yeah, I mean that does happen or used to happen. I mean that is really unusual, particularly with the technology and things that they've got nowadays. The pacing clinic, you've probably been in touch with. I mean that you'll be in really good contact with them, they'll be quite good at giving some support and things.
ICD management is a specialist discipline, and a patient with a device fitted will already be under the care of a pacing clinic. Whilst some patients will go to the GP to ask advice, it's best the GP advises them to call the pacing clinic they are already attending and who has their ICD records. Many clinics have a support line. Information from some devices can be downloaded through the patient's phone line, so if there is a problem, they may not have to go to the clinic.
I was also wondering about the batteries, the battery life, like, I understand that it's going to have to get changed at some point, but how long does it last?
It's quite variable, quite individual. It depends a little bit on how many times it has to give a shock and that sort of thing. But roughly it's about sort of 7 years.
So apart from that, say if I'm stable and stuff, and say if me and my boyfriend decided to start a family, will that affect it? Like, will it affect the baby? Is it okay for me to have a baby?
Yeah, no, certainly. I mean, it's really good to sort of start thinking about these sort of things now at an early stage, because yes, it is something that is inherited, and there is about a sort of 50% chance of your baby having it. Having said that, obviously there's lots of things we can do, and it is a condition that, you know, is and should be managed.
Yeah, it's quite a high risk.
So what would be sensible to do would be to let your cardiologist know now that you're thinking about trying to have a baby, and then also probably sort of refer you to somebody who can talk about the genetics and things like that too, and, you know, sort of give you a bit of support and get your boyfriend involved.
Yeah, that would be really helpful actually, yeah.
Yeah.
Cardiomyopathy is a genetic condition, so does need to be considered when planning a family. You should consider whether any medication is safe in pregnancy. Does it need to be altered with advice sought from their cardiologist? The sooner most women with any medical condition get preconceptual advice, the better. Genetic screening can be offered. It's also worth thinking about involving partners and suggesting they might like to come back and talk about it together, or make sure they can attend the appointment with the cardiologist. Pregnancy needs to be co-managed with the obstetrics and cardiac team. With all types of cardiomyopathy, patients can live full lives with correct treatment and management. There are further learning and support resources, including information booklets on the cardiomyopathies, regional information days and medical conferences.